Alright guys, we have a patient here with some symptoms. Let's go through them one by one.
Firstly, let me mention that it's colitis.
And you can't ignore the fact of cold compression therapy.
Lastly, there is omositis, which might give us clues.
Little boy and girls, I think we've got a patient here with immune thrombocytopenic purpura. It's not your traditional diagnosis, but it's what I think the symptoms are pointing to. We're doing a quadrantectomy here. It might be risky, but I believe this is the right treatment for our patient. Get to it, chat. Look, dude, I've been a doctor for years. You questioning my judgment on this is completely uncalled for.
I'm not questioning your judgment, Hawks. I'm just pointing out that you have been wrong in the past.
That was then, and this is now. I've got immune thrombocytopenic purpura all figured out this time around. Trust me on this.
This is grave news indeed, but we mustn't let our emotions cloud our judgment. We have to ensure that this patient receives the best treatment available.
Absolutely correct, Randall. And I believe it's my duty as a doctor to bring up some possibilities, even if they are unconventional.
I completely agree with you, Hannah. Unconventional approaches might sometimes be necessary when conventional ones fail.
What if we tried some experimental medication? It might not be completely mainstream, but it could potentially save our patient.
What do you suggest?
Antihistamines with some liquor.
Don't talk anymore. Thanks.
You fools. Do you not see how you nearly killed that patient? Immune thrombocytopenic purpura. Really? You're off by a whole quadrant.
We're off by a quadrant because we gave it an ectomy.
Wait, Dr. Hawks. We thought we were doing the right thing. What do you think the actual diagnosis is?
We'll get it next time, I promise. It won't happen again.
Learn, improve. You call that improving? Next up on the menu for your patients is a full frontal lobotomy.
Are you going to perform one on yourself so we make sure we don't screw it up on our patient?
Sup, bro? I've been hearing a lot about your patients.
Well, it's definitely challenging, but we're doing our best to support them through their journey. There are some cases that really stick with you, though, like this young girl who...
I might have an idea about her case, actually.
Oh, what do you mean?
Never mind, it's not important right now. I think I should get back to work. I've been meaning to check up on a few things.
Well, all right then. Take care of yourself, Hawks.
Holy hell, I am pissed off. Alright, let me handle this.
But you're not even wearing a mask. How can you?
That's precisely the point. I just figured out the diagnosis during lunch with Dr. Johnson.
Sclerosing osteomyelitis. Hawks, this is serious. You can't just throw around diagnoses like they're toys.
Hawks, it's not that easy. We have to confirm the diagnosis with thorough tests first.
Look, I know what I'm doing. I've studied this condition. The symptoms and the signs are there for everyone to see. We don't need more tests. We can operate now.
Even if it is Garrett's sclerosing osteomyelitis, surgery isn't the immediate solution.
Okay, you take them out of anesthesia while they're screaming in pain to tell them we're about to give them surgery. Dumbasses. Looks like even you've got something right for once, Tracy.
Thanks, Hawks. I have to admit, it was a bit of a relief when we finally figured out the correct diagnosis.
Relief? For who? You or that poor kid with Garrett's sclerosing osteomyelitis?
Don't forget, I'm not the one making decisions based on a quick fix instead of real research and experience.
That's quite rich coming from you, Tracy. You're the one who thought that just because we found some obscure condition no one had ever heard of before, it must be the answer to everything. So much for experience.
Go piss up a rope, Hawks. This conversation serves no purpose.